artificial intelligence now, not in future, will help you to give even customized treatment plan. Yani last week I was in a meeting with one of the company about also how to introduce more and more of artificial intelligence in the hospital. So now you can, through artificial intelligence, get customized treatment plan. It means that the system itself, through the patient diagnosis, through the patient file, medical records, through the patient family history, and depending on the international studies also, the system can suggest for the doctor the best treatment plan for the patient.
So is that practice just in Saudi German hospital, or
now
is
we
it?
are working on it, yes.
No, this is what we say. Now, lacking datas, lacking research centers will... Now, in Saudi German hospital, you've got your customized practice.
Yes.
Will I find that practice in other hospitals as well?
Let me tell you, now actually here in Dubai, the Dubai Health Authority working so hard about these subjects. So you can see for the last 5 years, as you know, we did in the e-prescription, it was mandatory for all private sectors. E-health records and automation submission of bills. For all, it was mandatory for all private sectors and healthcare providers. And now also for the pharmacy and the approval through pharmacy and through DHA. So can the regulator, they can have monitoring for all the pharmacy and prescription all over the healthcare providers in Dubai. Here in Dubai, the regulator is very much involved in the technology, and actually sometimes, as you said, sometimes for me as a manager, I have to force my doctors. As you said, everyone, sometimes not everyone, but you might see many people who don't like it, who doesn't like a change. So also, our regulator here, they force us. Yani for us as Saudi German, we like a change. We like management, knowledge, innovation, go into new things.
And do you share information? Do you share information?
It all go actually to DHA. We don't share it to each other. It all go to DHA, and in DHA they do their statistics, and these statistics to help them also in putting the study and analysis about the healthcare sector in Dubai.
So okay, then now, do you have anything else to say, doctor?
I don't want to say it all.
Because I will.
Later on, I just want to talk about, as a CEO, what the artificial intelligence and the knowledge should help CEOs in management, which is the non-medical part.
What I'm going to do, I'm going to introduce Dr. Ziad, and then I think I'll open the floor for questions. We get some questions from the audience, so just, Okay, Dr. Ziad Sankari. Ziad completed a BA in computer engineering at the American University in Lebanon, worked at the telecom engineer, and later received a Fulbright scholarship to pursue double masters in electrical engineering and biomedical engineering at the Ohio State University. In 2009, Ziad helped the founding team start a high-tech biomedical venture based in the United States. They won several competitions and awards for the venture, which was late acquired by an industry giant. Ziad conducted research with US and Middle East hospitals and has been a guest speaker at the White House discussing technology innovation in developing countries. Ziad also has a number of quality research articles published in the international peer-reviewed journals. Currently, cardiodiagnostic technology in transforming cardiac care in the United States and other global markets, with patients benefiting from the technology across all 50 states. In 2015, United States President Barack Obama invited Ziad to the White House, where the president recognized his work as innovative and pioneering on the global scene. So I will give Ziad a few moments to speak about himself and to speak about his business as well. Please,
Sure.
Doctor.
So I'm the founder of Cardiodiagnostics. What we do with Cardiodiagnostics is focus on cardiology and heart-related problem. The biggest problem we're facing is that there is a substantial number of patients who have cardiac arrhythmias or irregular heart beatings, and those patients are not being able to get diagnosed easily. So we created a technology that enables long-term monitoring of patients outside of hospitals, which reduced the cost of doing that monitoring and provided better access and better convenience for patients for their hearts to be monitored for extended period of time without being in the hospital setting. So the way we do it, we've got a patch that is usually, our products are FDA approved. They monitor the patient around the clock. They detect abnormality in the heart signal known as electrocardiogram or EKG, sends it to a cloud-based system, and then a dedicated monitoring center would do the monitoring and would create a report to make it available for cardiologists. We build artificial intelligence model to automate the process of analyzing the electrocardiogram, which is where I believe AI has a lot of value and a lot of role into it. We also built the first monitoring center servicing the Middle East, and today we're monitoring patients from Turkey throughout the Gulf states all the way to Australia and some European countries from that monitoring center. The US has its own, or North America has its own monitoring center separately. Now, I'd like to put this conversation into context. I strongly believe that AI has a lot of hype to it than what the reality really brings to the table. Think about Siri or Google Assistant or Alexa. Those are all presented to us as artificially intelligent products, which they are, by the way. I'm always impressed. I have a Google Assistant at home that I ask it to turn off the light, turn on the lights, and do very small and specific things. But compare what those can do to a very minimally trained human assistant without even a university degree. I think they don't even compare remotely. And this tells us where we are today with technology. I'm not saying technology will never take over and become much better. I strongly believe it will.
It will.
But where we are today is nothing close to discussing change or letting go of our clinicians or nurses or technicians or doctors, let go of that. Healthcare is a very deep knowledge-based industry, and you cannot replace it simply with technology, at least not where we are today. However, technology strongly has augmented and improved the way that we deliver care. And I think we've seen it in our space in cardiology, and a lot of other people have seen it in other spaces as well. It made the decision-making easier, just as we say earlier through this demo. I think in our space it has made it possible for a lot more patients to be monitored and to get diagnosed in ways that just 5 or 7 years ago was not possible. Our technology, and other companies are also doing a great job at that as well, has enabled better access to care at lower costs and much better convenience. And I think this is where technology and artificial intelligence can be utilized to the maximum. When we started building our artificial intelligence model, our clinicians who work in our monitoring centers, who are typically well-trained CCU nurses, cardiac care unit nurses, they came to us worried about their jobs. They thought that after we build our first functional prototype, we will let them all go. To be honest, that never even crossed my mind. The only thing I thought we could do is, instead of having one clinician being able to monitor 50 or 60 or 70 patients, we will let that same clinician be able to monitor 200 patients, 500 patients, reduce the cost of monitoring, and deliver those cost advantages to the user and to the customer and make their life a lot better. So I second Dr. Reem. I don't think at any point in time we will replace our doctors with AI, not in the foreseeable future.
So all of us are safe then.
Your jobs are in good hands, but I think it will make it a lot easier for physicians to make diagnoses and make decisions based on the knowledge presented and analyzed by artificial intelligence.
So let me put it down in this way. I mean, consider me as being a layperson. So when I go to a doctor or when I get any service, my intention is to get good service. I don't care where the doctor comes from. I don't care about technology. I want you to treat me, treat my condition. So this is what we say. Will technology affect patients' feeling? Will it really give them this kind of faith where they feel they're getting the proper service, they're getting in proper knowledge? I mean, are we using, from the title of this session, are we using proper knowledge to improve healthcare?
So
this question goes to Dr. Reem, please.
Not yet. We can do better in this. Sometimes technology important, but as you said, if it was not used well and not explained to patient well, it will become on the other advance. The patient will tell you the doctor didn't care about me, he referred me to the machine. So it's important also that the patients are educated well about these machines and about its role and its important, and the doctors also well trained about using technology. Sometimes you have the doctors are not trained well about it. They use it once, twice, and then they drop it out. It's very important for us to the continuity and keep pushing them till they are really comfortable in using it. Then this, when the doctor is comfortable, this feeling will be contagious, will go to the patient himself, and the patient will be comfortable in adding the technology element to that treatment plan.
Okay, let us take some questions from the audience. Please. Can you introduce yourself, please? We need a hand mic, please. Hand mic is coming. Please. Salam.
It's a real honor to be here in this session. Honorable speakers, my name is Samar Qawuba. I'm a Master's of Pharmacy student in Dubai Pharmacy College, a research assistant, and a pharmacy student representative in Dubai Police. So I have a question for you as healthcare professionals talking about knowledge today. So when we talk about healthcare, we're not just talking about doctors, we talk about pharmacists, nurses, so on. And when we see the knowledge, when we implement knowledge in this healthcare sector, then it will be wonderful if we cooperate. Thing is, as students nowadays, what we're seeing is we're using AI in pharmacy, smart pharmacy. I've been to South German Hospital, it's wonderful, as well in DHA hospitals. But we're not focusing on other aspects in the pharmaceutical field, like clinical pharmacists. Until now, I don't think in Dubai we have this yet, because the role of pharmacists until now is dispensers. So what is your input on that? Will we be seeing this in the future, other than just focusing on artificial intelligence? Because as students, it worries us, because we're graduating with such knowledge in the pharmaceutical field, but we're not able to implement it once we finish our studies. So thank you so much again.
But could you explain the role of clinical pharmacologist, please?
Sure. So as a the role of a clinical pharmacist is basically looking at the doctor's diagnosis, patient files, and making sure that there is no medication errors occurring, and extra medications added, a missing medication, duplication of therapy. So these all are some things that clinical pharmacists look at, as well as helping the doctor when prescribing the medications.
What is the percentage of error of a clinical pharmacist?
Well, knowing that there is the physician in there, and then there is the clinical pharmacist alongside, then I'm sure it's way less than when we depend on the doctor himself.
Okay, let me go back to people into technology. Can we come up with an app to reduce percentage of error and replace clinical pharmacists?
I mean, we can look into the future, and the old adage, and thank you, it's a great question actually. The old adage from one of the old physicists, I can't remember who it was, Lorenzo maybe, said that, if a butterfly claps its wings in Brazil, then, there's an earthquake in Texas, or whatever the thing might be. So we just don't know what's going to happen. That's the reality. I don't think that this will happen in our lifetime, so don't worry too much.
You'll have your job.
But I think, Doctor, you made a good point. It's about how can we reduce that error and that percentage of error, and I think technology can go a long way to reducing that. I think it's before we're a bit away from where we can sort of completely rely upon that. But absolutely, I think you see it in primary care, you see it in hospitals even. I'm sure that errors do happen. It's just it's completely human, and I think if you can use machines to
more accurately do a lot of the things that they're sort of good at doing, which is sort of accurate, processes that sort of relies less on human intervention, then I think that can only be a good thing.
So what I meant by when I tackled the concept of error, because when you reduce error indirectly, you affect the cost. I mean, it's a cost reduction. So the consequences of errors, you really pay a lot of money to correct your errors. So basically, when you concentrate on error reduction, so indirectly, you're reducing lots of cost here. So do you want to add
I want to invite you to the hospital because we have a clinical pharmacist in the hospital.
So you've got a new job.
No,
so if you don't have a job, you've got a new job. Better paid job.
I mentioned earlier, there is now in the artificial intelligence a project called Customize the Treatment Plan. Many of the big IT companies now are also developing this type about customized the treatment plan, meaning the system, depending on the diagnosis and the family history of the patients, and the international studies are also suggesting to the doctor the best treatment plan. It's still under process, but many of the big IT companies are going into that. So but if you want a human being, clinical pharmacist, you are welcome.
So you got the job. Congratulations. So we need the second question, please.
Hello, assalamu alaikum. I would like to ask, will technology reduce
Can you introduce yourself, please?
Yeah. My name is Ahlam Bagadir from Saudi.
أهلا وسهلا فيك.
I'd like to know if technology is going to reduce the hospital bill. That's question number one for me. I mean, will medication cost be reduced with the time, with the use of technology? And my second question is, I tend to be on the positive side, and I feel that technology can help doctors reach places like where wars are or poverty areas. I think we can advance tremendously there, and I would like to hear your comment on that. Thank you.
Yes. Now, Dr. Ziad, do you want to comment on
Sure.
our lady's question, please?
So look, this is a really good question because it cuts at the core of what healthcare is really about. In my opinion, the most important problem with healthcare is who's going to pay the bill. And this is a problem because the fact that in healthcare you have unaligned incentives. So you and the payer, you as a patient and the payer, you have one incentive. You don't want to get sick, you don't want to pay too much, and you don't want to stay a lot in the hospital. But on the other side, hospitals and the provider system have another incentive. They want to keep you in the hospital, they want to see you more often, keeping the ethical guidelines in check, of course. But nonetheless, I think technology has a role in making things a lot more transparent. In the US, I see a lot of people going to the website, to WebMD, and to other online sources to understand better what their problem is. A lot of people discourage it because you might end up diagnosing yourself with cancer while you might have just a simple cold. But the truth is, democratizing knowledge has made a lot of progress and has educated people a lot. So I do see that as one aspect where technology has made people more aware and they better understand what their bill looks like and what they can do with it. Now, I'm not going to comment on drugs. I don't know a lot about that space, but I'm going to comment about diagnostic technology, which is a space I know very well. I've seen a lot of great technologies all over the world that can literally save lives, and they did not make their way to the market because there's no clear path to reimbursement in the US and Europe and other parts of the world. I think who pays the money is a big question mark and remains a big question mark even in the most developed healthcare systems in the world. It will definitely make it a lot cheaper for a lot more people to access healthcare. It will make it a lot more easier and convenient for physicians to make a diagnosis faster and more accurate. And back to your very good comment, more accurate diagnosis means that lower cost of service. But again, we have to address the issue of who's going to pay for that and what are the aligned incentives in healthcare reimbursement.
Now it's Dr. Reem, please.
Role of artificial intelligence, as you said, who will reduce the bill after all? When you have when you talk about artificial intelligence or technology, you always talk about early detection okay, and preventive medicine, and follow-up, proper follow-up. So when you early detect, مثلا artificial intelligence now in radiology can help really in early detection of diabetic retinopathy or breast cancer. So if you can detect it before even the doctor is able to detect it, then the treatment will be much less. Then the cost will be also less. So this is the importance. Technology should focus about the awareness and the early detection and the preventive medicine. Will help you a lot about reducing the cost. On the other side, about the treatment, robotic surgery, if you study about robotic surgery, it's very important in fast recovery and fast rehabilitation to the patient. So if you do knee replacement or prostate surgery through robotic, it's one of the major advantage about robotic surgery is the fast recovery. That means the rehabilitation of the patient staying in the hospital is less, so cost is less. He will return to the work faster. That also he will be productive again and less cost on the government. About the treating patient abroad through it's e-health. E-health is really advanced, but not, I will tell you, e-health not advanced in GCC area because doesn't need. But you go to India, they have great experience and successful experience about e-health. Why? Because you will have patients who are 3 hours far from the doctors. They cannot. So the only way is a computer and the doctor who is a 3 hours drive. Then they will discuss together and he can help him. So it's working, but again, it will not. Patient doesn't like to use it if they don't need to, because it's always this communication, direct communication with your doctor is really important. So when you have access to your doctors, you will go. But when you don't have access in a big, very big countries and like that, you will go to e-health, and it's working successfully in India. You can have a look at this.
Yes, Conor, you want to add something here?
Sure, and if I could just sort of echo what Dr. Reem said, you know, I think the reality around sort of accessing populations globally using artificial intelligence, technology, whatever it might be, I think we're reaching a point where there's no reason why we can't provide the same level of certainly sort of initial diagnostic capabilities, information about healthcare to pretty much everyone globally. You know, there's 10 trillion, you talk about cost, $10 trillion a year spent on healthcare globally, but yet 50% of the world's population don't have access to healthcare. 5 billion people don't have access to basic surgery. So whether you're in Ireland or India or, you know, Dubai or Durban or Africa. And a direct sort of you know, indication of sort of the direction in which our company is going is that, you know, we launched in Rwanda 18 months ago. We now have 40% of the Rwandan population, with thanks to the Bill and Melinda Gates Foundation partnering with us to provide effectively virtual care to the population there. And that's something that has an immediately profound impact on accessibility, but also accurate information, education for people who otherwise just don't have access to it. And there's no reason why we can't do that with AI. You know, we've got an app which we can deploy in every single market in the world, and effectively that information, once it's localized, once it's translated, available in every language, which we're doing at the moment, it can be available to, you know, a farmer in rural India. There's no reason why we couldn't do that.
Okay, third question. Okay, please. So I'm not going to ask, and I'll just allow the audience to ask.
Thank you.
Who's asking? Oh my God. Okay.
My name is Dr. Mayada Abu Affan. I'm a director of...
Please, you can sit, please. Yeah.
A director of public health and prevention for Health Innovation Advisory, a company, an American company working with the DHA, Dubai Health Authority. My question is about the role of artificial intelligence. Dr. Reem, you touched on the prevention aspect. The role of artificial intelligence in proactive prevention, especially on lifestyle and lifestyle-related diseases, something beyond the wearable and the monitoring technology like the iWatch, something that is going to motivate, give the psychological support, and use the human motivation theories and behavioral change theories to enable, for example, smoking cessation on a population base. Because if you do this on a one-to-one basis, it's going to be really expensive if you want to make a paradigm shift across the population. Thank you.
Please. So, no questions then. It's only comment, isn't it? The question two.
Babylon and Dr. Reem and the cardiologist as well.
Okay, Connor.
So in the future.
Sure.
Can you repeat the question again, please?
Do you see technology coming in the pipeline where it will support prevention proactively? For example, smoking cessation, to provide a one-to-one smoking cessation advisor on a population basis. For example, UK, the smoking rate is 25%. 25 of 60 million is so many millions. So you cannot provide a one-to-one advisor to the whole those millions. So this is where I see the role of artificial intelligence in terms of support and psychological support, not just giving the information and the...
Yeah, this is what we were talking about initially. Patients need somebody, like a human being to sympathize with the other part.
I agree, and I think it's a great question, and my brief point of view is that I think it's already there. It's already available. We're doing part of that now, so we have just on the sort of preventative side, and all of our conversation, apart from maybe something that Dr. Reem said, has been around sick care. How can we actually get people better in a more cost-effective way and reach more people? But yet we don't really ever focus on healthcare, which is the sort of preventative side of things. So what we started to do is start assessing people when they're well. So we've developed a chatbot assessment, like a health check, which you answer a series of questions, and it then populates a digital twin of you. So you have your own digital twin, which you then can see your risk of disease. And the idea behind it is that we can really visualize in a really meaningful way for people what their potential for contracting particular diseases are, and visualizing things like, in a really sort of graphic way. So if you take your lungs and you're a smoker, we can sort of show you what that might look like in 20 years' time. And that might be a little bit beyond sort of what we're talking about right now. And I think there's an element of, we need to do this, we then need to give that information to the sort of coaches and the people that should be, every professional footballer or every footballer in the world has a coach. There's no reason why people shouldn't have coaches in healthcare. And I think the reality is there needs to be much more of a focus on this. And one thing I would say is that it's not going to be one company that does it. I think there is an ecosystem, and the amazing thing about healthcare is that it's the one industry or one of the industries where collaboration can be incredibly powerful. And I think that's where you sort of need these new innovations coming through, being adopted by public authorities, partnering with other companies, the regulator getting on board to make these things sort of come to fruition and come to market as early as possible.
Okay, so question? Okay, please.
I'll just give a comment.
I would like to. Okay, I've got our lady, a second lady there. Number 1, 3. Sorry, ladies first. I'm sorry.
My name is Susan Tikri. I have 2 questions. One to Dr. Reem and the other one to Mr. Connor. Dr. Reem, can you just briefly explain to me or go over what is robotic surgery? I'm not familiar with that. That's question number 1. Question number 2 to Mr. Connor McCarthy. You talked about the virtual healthcare in Rwanda. Could you just briefly touch upon it? How is the interactive phase? I mean, as far as I'm concerned, the interaction we have with technology is far less retentive than when we have with humans. If I speak to you, human to human, I'm more likely to absorb more information and understand better than to speak to a machine who will give me information. So how does that fit into the context of the healthcare that you deliver in Rwanda? Thank you.
Okay.
Okay,
Dr. Reem, please.
I'll just give comment to the lady before, because I think it's very important subject, and the primary health care is really concerned about it, about the preventive medicine. In artificial intelligence, there is something called predictive medicine, and they can analyze the patients. They can know the similarity and the type of patients. So through artificial intelligence, you can see through the medical record and analyzing the patient who are smoking in their nursing assessment. These smokers, okay, then the system can send them awareness message through the mobile app related to their smoking habit, although they were coming for a cough for the doctor, you see. So they were coming for a separate healthcare problem for the doctor. But the system, when analyzing their medical report, they see maybe they are diabetic patient, so there is focused education program for the patient can be done through artificial intelligence. So either if you are diabetic patient, even if you are going to the hospital for something else, the system will catch you as diabetic and will send you a pop-up message and awareness education about the importance of examining your retina every 6 months. Such a program is help in preventive. Robotic surgery, my dear, is a robot that will do that. The doctor will be on a station. The doctors will be managing the robot. The robot is the one who's doing cutting and suturing and doing the surgery itself. So the doctor will be on a station like this, the patient will be here, and the robot doing the surgery. Because of the robot there, it will be much more lesser, the incision is less, the bleeding is less, and the recovery is better. And doctors there are two parts. Doctors who's not trained to do it, so still they don't know too much, but some doctors who are used to it, as I said, technology adaptation sometimes is difficult in the beginning. Doctors who are using to do masalan urology procedure through robotic, they cannot do without it. They are used to it and they really like it.
Now, one thing to add regarding your question, madam, we've got different robots. Nowadays, the robot is guided by a human being, which is a doctor. So basically what technology is trying to do is trying to steal human being talents. So if you agree. So what happens now, it's a machine and it's a brain. So technology is trying to steal 1,000 brains into one technology where the machine can, it will do you the service without the help of human being. Basically you steal the brain, you put the brain into the machine, and the machine does the job. Now this is what, when we go back of percentage of error, when we steal 1,000 brains, super brains, put it into a technology, so percentage of error is much less than what you expect from human being. So even, because what happens, now human being, basically sometimes they get into lots of effects. So when this, for example, they may lose their brain or lose their thoughts in a procedure, but it never happens with machines. So rate of error is much less than human being. So nowadays, I think they're trying to come up with innovations and technology where human being gets out of the field. So you get specialized cook where the machine does everything. You get special car without a driver. You get special plane with no pilot. You get special surgeon, no human being.
And I think to add to that, the reality is for those sort of, and it's amazing what they're doing with
because human beings get interacted basically.
Exactly, and there's confirmation bias, and there's their emotion comes into play. So if you can take those things out of something as important as surgery and precision surgery, then that can have a really huge impact, I think.
Okay.
Just to touch on the second question, which I think is around sort of, I think engagement through a virtual medium with a doctor or AI and sort of our experience of that. So. Sure. Okay. So the question, the second part of it is around how do we sort of how do we make sure that that information that comes, is that being retained if it's coming through the AI? And I think the reality is in somewhere like Rwanda, where health education is so minimal and information about particular areas of your health is just non-existent. So you're absolutely right. AI may not be the first thing to introduce there, and which is why we went to Rwanda 2 years ago. And actually what we did was we enabled our clinicians with the AI capability, so that, okay, someone's not necessarily going to see a doctor or a nurse in person, they're still connecting with them by phone, or well, in Rwanda it's just phone because they don't really have smartphones, it's just feature phones. But we developed a capability whereby we can enable all of our doctors and our nurses with the AI. So actually the information that they have to hand is much more powerful than they would originally have. And it's not just doctors and nurses, maybe operators as well, but the point is that they can then use the sort of human interaction to actually provide that information to individuals. In time, I think a lot of that will come from, once the technology becomes sort of more commonplace in somewhere like Rwanda or other developing countries, people will use it. But I agree, there's a sort of maybe, the one thing I would say is about adoption of that sort of technology. In somewhere like Rwanda, they introduced mobile money, so they went straight from checkbooks to mobile money. So they cut out ATM cards, they cut out everything in between. And the adoption of that was incredibly fast. So, once people see that there's a value in it, there's a sort of a threshold. Once you get over that skeptical bit, it will happen, and then it will, exponentially grow like nothing you've seen.
Dr. Sankari, will technology affect the nature of medical research?
Well, absolutely, I think, based on the fact that you just mentioned earlier. What's beautiful about technology, or particularly the machine learning and artificial intelligence space, is that you combine a massive amount of knowledge into one computer software, and you democratize access to that software through the cloud or through the mobile app or other platforms. So you just touched on who's a good surgeon, who's an average surgeon, who's a good doctor, who's an average doctor. Usually there are two differentiators that make a good doctor differentiate himself or herself from an average doctor. It's number one, experience; two, intelligence and intuition. Combined with both, you usually get top-notch doctors. So what we do with artificial intelligence and machine learning is you get a massive amount of knowledge from top surgeons, from top physicians, from top researchers, and you put it into one place, and you build something commonly used in the literature as neural networks. You get a very deep neural network, and you tweak it in certain ways, and you train it on that data, or you use different other machine learning approaches and make that kind of knowledge accessible to a lot more people. So obviously, with democratizing that knowledge and making it accessible, you're making the level of care a lot better, so everyone can have access to the top-notch doctor, not an average or below average doctor, as you might have in not so developed countries usually.
Thank you. Madam, please.
Assalamu alaikum. I'm Reem. I'm an educator. My question is about the trust. How I can trust the artificial intelligence with my medical information, that my data in the future will not be misused or abused? Or is this the price I have to pay to have the better access to the healthcare in the underprivileged areas, like you're saying Rwanda and India?
Dr. Ziad, I'll just...
Sure. So when you ask about trust, are you concerned about your patient information, your confidential information, or the outcome? Is it patient information? So this is where governments have a big role to play. In the United States, they have a law that is dedicated to dealing with protected health information or private patient information, known as the HIPAA law. HIPAA stands for Health Insurance Portability and Accountability Act. So there's just a law that has to be followed and that mandates what companies and service providers have to do in order to protect your health information. I think other countries have to follow through with enabling or legislating new laws that enable those technologies to protect your healthcare information and prevent it from being sold to other payers or other companies or other entities that you do not want them to have access to your protected health information.
This is the law right now for but if all my information is with artificial intelligence, and how it cannot be hacked, what is the healthcare doing about cyber security, how to protect my medical...
You sue the machine.
Or the creator of the machine. So, to be honest, this is a complex question, and it goes back again to how you enforce the law and what people are doing to take that law seriously. There are a lot of technologies out there, and there are a lot of companies that are specialized only in protecting, in cybersecurity and protecting health information. So there is a lot that could be done, but that never prevents you 100% from avoiding leaks or problems. There's always a risk of having that that data leaked. But the more you invest into your infrastructure, the more the companies put into their systems, the more likely that this data will remain protected. But don't forget that even your physical data can be breached if somebody accesses those physical papers and steals them or takes them, or they're left during transportation, or they fall during transportation. That's a breach. So the risk is always there. It's about how much you should do to protect it, and that's again a government role to play.
Never, you just always accept changes, because this is nature of life. We have to accept changes. And through research, we can correct lots of things. And through trying, we can correct and avoid lots of mistakes. So the gentleman, as I promised him, hello? Please, yeah, please.
There is another lady.
No, don't worry, you are the one. 2 + 1.
Assalamu alaikum. My name is Shamsul Arifin Sohel. I'm from Bangladesh. So my first question is to Dr. Reem. I'm really honored to be had connection in the LinkedIn. So I'm really, one of her fan actually. So I heard that a moderator was saying something that she had some activities in Bangladesh.
Through the profile, you had some business in Bangladesh.
No, it's in the charity activities. We go into charity medical camps to the refugees there. We went there.
Camps.
Yeah, Rohingya camps.
That's a big vulnerable position now we are in. So my second question is to other speakers, that Bangladesh now aspiring to change the healthcare system. Already there are some initiatives taken by the government, like one of the biggest burnt hospital now is in Bangladesh now, and towards the e-healthcare system changing, so government is aspiring the support from the modern world, like the company like Babylon and the other modern technology providers. They are most welcome. So do you have some initiatives taken for Bangladesh? Do you have some plan?
Do you have any plan? He's inviting you. He's inviting you to visit
Thank you
Bangladesh.
very much.
Yes.
To be honest, we have a sort of a clear roadmap on countries. Effectively, we want to be present in every country in the world. Currently, you can download our app in every country and use it. However, if we go and provide a full service that includes doctors, etc., the three aspects of on the earlier slide that I showed you, AI plus virtual health plus physical, we would obviously need to go there, set up, partner with clinics, or set up our own sort of clinical services, etc. So perhaps it's, at one point we will get there. We will launch in Southeast Asia this year or next year in 12 markets. We will launch something with the Kingdom of Saudi Arabia next year. We have a big focus on the US. I absolutely agree. I think there are huge opportunities in places like Bangladesh, also Pakistan, where there's a significant need for better quality healthcare, better access to it. I think the governments will play a big role in sort of attracting that into the company if it's not going to be sort of created indigenously. And as Zayed said earlier, the opportunity is there for regulators in every country. It shouldn't be a barrier to sort of, e-health and technology and AI should not be, the regulator shouldn't necessarily be a barrier to the adoption of that. I think it's going to be important for them to embrace that innovation, and the sooner we see that from, governments globally, then I think there's a lot higher chance of companies like us and like Ziyad's and like Saudi German Hospital, actually launching in somewhere like Bangladesh.
Okay. Thank you very much. Late, please. No, we need, because the audience would like to hear the question as well at the same time. Thank you very much.
Thank you so much for all this valuable information for all of you. My question is, artificial intelligence so far, I see it as much useful in ordinary diseases. But what about the complicated diseases such as cancer? How technology and artificial intelligence can enhance the treatment of cancer, all kinds of cancer, other than early detection? Because so far the treatment of cancer is like as if you're saying to the person you're dying, and all the treatments that we have is palliative treatment.
Yeah, palliative treatment.
Yeah, you're dying anyways. So how technology can enhance that? Because most of the people who are diagnosed with cancers are sooner or later are dying. Thank you.
Dr. Reem, do you want to answer that question?
I think we should look at cancer now on this side with more optimistic look, because there is now a lot of successful...
The word itself is really threatening.
Yeah.
So
well, my mother died out of cancer.
That's why you are talking from experience. But currently, and even from our patients, we have the oncology department, we have really success stories in treating cancer, even when it comes to cancer degree 3 or 4. Artificial intelligence, as you said, helping in the early detection, whether breast cancer, whether when it comes to histopathology, also in the lab, early detecting, which by default it will be better.
Dr. Reem, let me summarize your question.
Yeah, I know, but
will technology eradicate cancer? Eradicate it. Complete finish of cancer, like previous diseases and conditions we had.
Cannot, because will eradicate diabetic, also will eradicate blood pressure.
So this is what we mean. Will at some time we hear no more. No more cancer. Can we come up with this? Can we see no cancer in future?
But as they said, there is now many ideas about new treatment modules, genetics, stem cells, many things now, and now becoming a curable disease. Cancer anyway, it's not becoming non-curable anyway.
Preventive as well? Can I use something that prevents me?
I think if it comes into artificial intelligence with mass detections, plus the genetics, which comes into, now with the genetic study, they are selecting or identifying people who might have the cancer before having it. That's why when you capture such patients before they become patients, here where you eradicate.
If they get tackled with cancer cells, can I detect with technology? Will I be able to detect the defect in that cell and correct it? In a matter like, if you've got an infection, you know that you're infected with such microorganism. So you take a proper medication for that microorganism. So will technology come to a state where it tackles
we hope that, and that depends on the analysis. So if analysis is because as we said, the analysis was through the artificial intelligence, depending on the family history. So as you said, when there is any family history, relative having the cancer, the system itself, because sometimes the doctors will forget to ask you, even if you put it that, or will forget to tell you that you might have a risk. So when the system itself will capture also people who has family history of cancer, who might have even through lab test to genetics test more also can have cancer more than others. The probability is higher. These people later on might have more deep tests or more extensive tests, and then you can eradicate cancer.
So will
I'm afraid to say it, but maybe treat it in the very, very, very early stage.
So will a device treat my skin cancer?
Now, yeah. In dermatology, They are working on that.
Okay.
You are
Technology
dermatologist doctor, that's why you want to reach this point, yes.
Any comment from our guest speakers about getting rid of cancer? Please, Dr. Sankari.
It's we're passing into each other because it's a very difficult question to answer.
Yeah.
I think the reality is, and Dr. Reem has done a very good job of trying to articulate it. I think the reality is we just don't know. There are huge advances being done in genetics and actually how we modify cells, etc., to be able, once we detect it, will we be able to reverse it? There are a lot of questions that we just don't know. There's massive amounts being invested into in medical research, and I would say that AI can assist in that research, and computationally we can start to understand a lot more data in a much quicker time period. So for things that might have taken 100 years to understand, we can now begin to start understanding them in much shorter periods of time. Will that enable us to start reversing that and pick it up before it even manifests itself? I'm not sure.
Okay, so one last question, please, our lady.
Hi, my name is Yasmin, and I'm studying environmental science at New York University. This question is directed at Mr. McCarthy, but anyone can answer. Now, as we know, climate change, pollution, man-made events are either directly or indirectly causing an increase in health problems worldwide, but generally in third world countries. So is Babylon kind of taking this urgency into consideration, considering the fact that human health is generally declining in these parts of the world? Is there a plan for this, and how are you kind of dealing with this resistance against AI? Because a lot of people don't have, they don't really have the option to say, well, I don't feel comfortable talking to a machine, let me see a doctor. A lot of people just, they don't have that problem. So how do you plan to deal with this resistance?
I agree, and I think it's a really good question, and if I can just address it really quickly, I think the challenge is not necessarily about how we sort of get people to start using that information to their advantage and using once we put it into their hands, we know that people in developing countries and where the need is greatest, they will use it 100%. We're absolutely convinced of that, and we've seen it in Rwanda. We're seeing it in other countries that we're now going to launch in East Africa, for instance. I think there's a huge need in, as I said earlier, half of the world's population don't have access to basic healthcare. So that will get worse unless we do something drastic right now. I think that's where you have, organizations like the Gates Foundation who are enabling us to deliver healthcare in developing countries. If you sort of couple that with the ability of, say, a huge telco or a telecoms company to then distribute sort of some sort of technology to masses and populations of people, it's where collaboration in an ecosystem can have its greatest effect is in developing countries and in countries where that need is greatest. It is absolutely on our roadmap, and we continue to try and deliver that to those countries as quickly as possible. And I think, I don't know.
So yeah, basically to finalize, because I think time is up. So utilizing knowledge to improve healthcare, I need one recommendation from each guest, please. Dr. Sankari. I need a final recommendation, one recommendation.
I recommend that we believe in technology and embrace the change and be positive. I strongly believe that technology will make our world much better. And one thing that proves this point right, go online and look up life expectancy over the past 50 years in your home country or any average country around the world. You'll see how, due to technology, people are living longer and longer.
Dr. Reem, please.
Using technology to help us medically, help in awareness, in education, in early detection and treatment, and help us also use technology and help us in the management part of the medical field, in about budgeting, in about making the right decision, and about fixed asset utilization, inventory management, using technology in the full cycle of healthcare services from calling the patient till making the decision by the CEO, using it in a proper way, is really a good way for us for the future and building a healthy healthcare sector.
Mr. McCarthy?
One thing I would sort of just like to finish on is, if you have, if you and I, doctor, have the same access to a library of books, does that make us as knowledgeable as each other? And I think the answer is no. It's how we use, it's how first of all we interpret that library, that information, and then how we use it and intelligently use it in a way that we can fundamentally change the way that we're delivering things like diagnostic capabilities, or increasingly going into secondary care and improving surgeries. But fundamentally we need to be using that knowledge, sharing it, and then intelligently disseminating that across the globe.
So in conclusion, life is really changing. Please accept those changes. And without knowledge, we cannot improve healthcare. Thank you very much.